Dr. Shannon Wong, and I'm just going to describe my usual PRK technique. We have a 35-year-old gentleman who's myopic with astigmatism, and we've selected PRK as the treatment of choice because he has thin corneas, he has a normal corneal topography. Usual treatment time is about 5 minutes per eye. And the first thing we do, we've numbed him with proparacaine. We then score the corneal epithelium after we've identified the treatment zone using the Vizx reticle. I just do a few clockwise and counterclockwise turns for a few clock hours. I then just press firmly toward the back of the globe with my trephine. I instill 20 to 30% diluted alcohol. I've used ethyl alcohol and isopropyl alcohol, and both work perfectly fine. We set the timer for about 20 seconds, and then I take a new wet sponge and I absorb all of the alcohol from the well, and then I just take the well and the sponge off in one movement. We then irrigate the corneal epithelium with 20 milliliters of balanced salt solution. Patients are very comfortable. I usually use 4 or 5 drops of proparacaine during the surgery to keep them comfortable. They're just asked to look at the reticle or the fixation light. This is the second 10 cc's of balanced salt solution. Once we've instilled the BSS, we just use a blunt spatula to remove the corneal epithelium from within the area that was pre-marked by the trephine. It comes off very easily. And I usually just remove 8 to 9 millimeters because that's usually about the treatment area for our ablation. Any blunt instrument can easily remove the corneal epithelium. I don't use a brush, I don't use laser scrape. I've just always used the alcohol removal technique, and it seems to work just great. So now that we've removed the epithelium from the area that we're going to deliver the excimer ablation to, I try and just get a nice homogeneous area that's hydrated with balanced salt solution. Once the hydration status has been made consistent, I use several wax sponges that are fresh and new and dry to get a real consistent surface for our excimer ablation. I don't want any streaks of moisture on the Bowman's layer. Sometimes I'll just grab a second sponge just to make sure the dryness is consistent throughout. And you can tell just by inspection if there's any extra moisture on there. But you need good, adequate lighting to make sure. Then we just kind of turn back on our reticle, engage the pupil tracker, the iris registration, dim the illumination a little bit to capture the pupil. And then we deliver our ablation, which usually, for this particular patient, it takes about 25 to 30 seconds. So we're using a wavefront guided ablation with a Vizx S4 star laser. Here we turn down the illumination of the laser and you can see the treatment pattern of the excimer laser. Now at the end of the ablation, we're basically done, but we do want to prevent corneal scarring. So for all PRK patients, I've adopted the technique of using mitomycin C 0.02%, and I usually apply it for about 20 to 30 seconds to the ablated area. I used to hydrate a sponge with mitomycin C. Now I just try to drop one drop of mitomycin C directly to the ablated area, and the surface tension of the drop keeps it together, and then I kind of gently spread the mitomycin over the area that was treated. So there's my drop. It stays together, and then I just use a little blunt spatula to spread it around, and I have my assistants count to about 20, and then I'll irrigate the mitomycin C away with another 20 milliliters of balanced salt solution. That's 10 milliliters. We followed up with another 10 milliliters. And then once we're done, we apply one drop of a non-steroidal. In this case, we had Bromday, and one drop of an antibiotic. In this case, we used Zymaxid. And then I always use an Oasis 8.4 base curve soft contact lens to be used as a bandage. I found that is the best contact lens in terms of comfort after doing PRK or surface ablation treatments. I would say 95% of patients are very comfortable throughout the entire healing period of a week that I leave this contact lens on their eye 24/7. A lot of times I'll impregnate the contact lens with antibiotic and nonsteroidal before I place it on their eye. And then that's the entirety of the procedure. Thank you for your time and attention.